to show you how you don't feel like you're getting scammed at the dentist. I'm Dr. Rosie. I have been a dentist for over 22 years, and my job is to make my patients feel very confident, very secure, and knowing what they are getting and receiving, because after what I show them, they are 110% certain that they have an issue and they need to take care of it. So you guys probably know, you guys been to the dentist and you're like, how do I have like 6 cavities? I don't remember ever getting cavities at my last dental office. So here's a tip. What you want to do is, just because they're using the x-rays, you want to ask them, can I see a digital photo of it? What that means is you want to basically have them whip out their intraoral camera. Now, if they say they don't have one, tell them to whip out the phone, okay? Just whip out the phone, take a snapshot of the area, and show it to me. That's what you want to do. Because there are times when my intraoral camera didn't work, I just whipped up my phone and said, here, let me take a quick photo, hold on, let me show it to you. When the patient saw it on the photo of my phone, they were like, oh my God, I see it. And there was no denying it whatsoever. Another tip that I also use is our iTero scanner. So let me show you what that is so you guys really understand what that looks like. And a lot of offices have this. So, oh, there's Finley laying on the ground, our therapy dog, but let me show you. So this is our scanner, okay? So this is great. This actually shows you a real virtual look in your mouth. And you guys can see, when I show this to my patient, she's like, oh wow, I have a cavity. Look at that. That is so obvious. And of course, it was a great way for us to show her where she wasn't brushing well. She was getting all this buildup. But look at over here. When I showed her about this guy, she's like, what's that dark spot? I said, oh, you actually had a filling there and it started to wear away. And now you have kind of like, almost like a pothole happening because you've been wearing it down. And of course, you can see there's something forming, almost kind of like decay, beginnings of it stages. So she's like, oh, I totally get it. And I just cleaned it out, filled it up with a new filling. So yes, you guys want to ask for a scan. This is a great way to really visualize and see if there is truly a cavity or an issue of the tooth. But this really helps when you start to see something in a real live digital photo. So those are my tips, you guys, of how not to feel like you're getting scammed. Don't just rely on x-rays. And nowadays there's also digital AI that's actually helping doctors diagnose and detect cavities. So it's kind of nice having like a third party kind of diagnosing and helping the doctor to see things. But that's also a great way. And you guys remember the Friends episode of Jennifer Aniston when they were trying to show her baby on the sonogram, and she was like, yeah, I see my baby. And then she was like lying because she's like, I don't know what I'm seeing. So I totally get you guys. So those are my tips of how not to get scammed. And if you guys want any more advice, hit me up. I'm always happy to do any virtual consultations to help you guys out. And also follow me for more tips. And sometimes I'll jump on live and you guys can ask me real life questions as well. Peace out.